I'm going to speak to you today about acne, what tends to cause acne, and maybe some simple treatments which will help. This isn't meant to be a comprehensive guide. There's always going to be people who've got their pet theories, etc., etc. Often they're quite rude when you produce a video. It's not meant to be anything comprehensive, and I'm sure Mrs. Jones from Harlow uses fish oil on a Tuesday and it helps. But in reality, I'm going to talk to you about a common approach to acne. So acne really is active pilosebaceous glands, grease glands, which produce grease on the skin, which get blocked, causing whiteheads or blackheads, which then get infected with C. acnes bacteria, and you get pustules. So the treatment's aimed at treating these. So my approach is quite simple. I start off with a topical agent, and the common one that I like is called Epiduo, which is a mixture of benzoyl peroxide and adapalene. So that's a retinoid, synthetic retinoid, and this reduces production of oil, shrinks the pores and kills the bacteria and sort of cleans the skin. It can be quite irritant, so it needs to be used carefully at increasing dose, and there are lots of other things that can be used. Certainly salicylic acid washes can sort of take the grease off the skin and help to unblock the pores. We quite often use an antibiotic for at least 4 months, and often rotate these because you get resistance for the C. acnes bacteria, and I often use a tetracycline initially because it is effective and is also anti-inflammatory. And often this approach works in a large percentage of patients. Sometimes, particularly in women with jawline acne, I use an anti-androgen, which can either be Dianet, the contraceptive pill, or something called spironolactone, which is a diuretic which has anti-androgen properties, and this is really very effective, particularly in women in their 30s who have androgen-driven, that's androgen-sensitive acne. I also see patients with steroid overuse, men bodybuilders, etc., and these are quite difficult to treat. Another thing that we use is something called isotretinoin, which is oral vitamin A. This is highly effective, but does have quite a lot of side effects. So those combinations of treatments alone work in most cases. We can add in red, blue light, LED light, and there are a whole range of other things that you can use, but those are the standard things. And most patients, if you take a fairly proactive approach, will get resolution of their acne. It may come back when you stop treatment, but that's my initial approach. I hope that's helpful. If you've got any concerns, please do get in touch. Thank you very much indeed.